Roger Williams University is hosting a crisis management seminar on May 3rd at their Providence campus. Crises, whether a natural disaster, cyber attack, or financial instability, can have severe repercussions if not handled properly. This is where crisis management plays a pivotal role. Join Roger Williams MBA students and expert speakers to learn how to prepare for the unexpected. The program is totally free and open to the public. You can register online at rwu.edu/events/crisis-management-symposium.
This is the Bartholomew Town Podcast.
Hey everybody, welcome into another episode of the Bartholomew Town Podcast. It's Bill Bartholomew here with you as always. Today we return to our series Inside Rhode Island Public Health. Just a few moments ago, I sat down with Commonwealth Care Alliance's President and CEO, Christopher Palmieri, and Senior Vice President Corey McCarty for a discussion following the ribbon cutting at their new Providence office and what it means for the healthcare ecosystem here in Rhode Island, as well as, frankly, jobs. And, we've been talking a lot on the podcast about this concept of the new Providence and the old Providence. It's something I've raised because there's a lot of exciting things happening in Providence, but we also can't leave behind the existing community. And the idea is to marry these two equations, if you will, to arrive at some kind of harmonious and hopefully eventually utopian version of our city, right? I mean, let's be honest about it. And of course, as the city of Providence goes, so goes the state of Rhode Island. I think I even used that tired expression in the actual interview. So, but it's true, and so seeing an event like today where CCA is establishing a footprint in a physical sense in the city, in the innovation district, and realizing the potential for an organization like this to, serve as an employer on the one hand and also as a core element of our healthcare ecosystem, I think it's big time stuff. It's not the type of thing that's going to grab every headline in the world and may not even catch your attention, off the bat. But nonetheless, critical to where I think we need to go as a city. And again, that also impacts our state and our region just in terms of blending both sides of that new and old Providence conversation. So this is a quick interview. We sat down in one of the offices at this new facility and hopefully get a little perspective on what CCA is bringing to Rhode Island as a new element in our ecosystem, relatively new. They've been around for a minute here, but certainly with their footprint in the Innovation District, things are ramping up. Inside Public Health is brought to you by Commonwealth Care Alliance, Rhode Island. Commonwealth Care Alliance, or CCA, is a multi-state integrated care system influencing innovative models of complex care nationwide. CCA's Uncommon Care model focuses on sustainable and evidence-based healthcare breakthroughs that improve the health and well-being of people with significant needs, and is consistently recognized as one of the best models in the country at identifying and serving traditionally hard-to-reach individuals. CCA is excited to bring Uncommon Care to Rhode Islanders with a range of Medicare Advantage plans. To learn more, visit www.commonwealthcarealliance.org/Rhode Island. Big day today with the opening of the Providence office. We're in the Innovation District. This is something that is crucial to the city as a whole, and as they say here in Rhode Island, as the city of Providence goes, so goes the state of Rhode Island. So let's start there. You're a building block now in this equation that is the new Providence, this effort to quadruple down on meds and eds and tech as a building block for our future. Talk about that role that your organization is playing.
Yeah, so we're super excited to be here. This has been a vision of ours since I joined Commonwealth Care Alliance in 2015 to expand ourselves outside of the state of Massachusetts, and Rhode Island is our first expansion market. So we believe that we can bring better health care and more affordable to people that need it most, those with significant health care needs, and we thought that it was really critical for us to build a beachhead here in Providence where our staff will come and work and then go out into the field and serve our consumers. And we do feel that we are part of the innovation equation here because the way that we approach our consumers is quite unique. We're addressing whole person through our healthcare approach, which means that it's not only their medical needs or clinical needs, but also their pharmacological needs, their behavioral health needs, and those social determinants or barriers that are getting in the way of them accessing good, healthy lifestyle like transportation or environmental safety supports and things like that. We can help consumers live their best life in their homes.
Yeah, location is critical as you think about Rhode Island, and as you said, this being the Innovation District and our focus on healthcare delivery. We've got great partners within 1 mile radius around our building. We look at partners like Lifespan, Care New England, Coastal Medical, Brown University right around us, the URI and Rhode Island College Nursing School right next door, and Social Enterprise Greenhouse and Cambridge Innovation Center right down the road. This is an incubator for doing things differently, and to your point, really being innovative about healthcare delivery is something that Commonwealth Care Alliance has been known for, and part of what drew me here.
So in terms of the jobs that you'll be able to provide, and then the sort of secondary and so on and so forth, markets that you'll be able to expand on. I mean, that you could make an argument that you're going to expand DoorDash or something like that as well. I mean, this could go on forever. But what role can you play here with your beachhead here in terms of just being a job provider, and not only a job provider, but in an industry, in a sector, a super sector that is so critical to where the state's trying to go?
Yeah, so we're starting out, obviously, as we grow, so do our associate base grow. We've talked a lot about CCA Health Rhode Island today, but we also did bring a company by the name of Instead into the Rhode Island market as well, and that's our mobile paramedicine program. That's been active since January of this year. That's been an important part of how we've entered the market. That fills a void that doesn't exist in the delivery system today in the state of Rhode Island. We expect, as we continue to grow, that not only are we going to do things that are going to be innovative and different that will create jobs, but we're going to be partnering with local community organizations, providers, and small businesses that will also help them get more innovative in the delivery system and likely bring jobs to them as well.
We've talked about this in the past, but as COVID evolves, people say the pandemic's over. We heard President Biden say that. It's probably true in terms of fundamentals, but what's not over is the gaps in healthcare that we learned. That's not something you can solve in a couple of days. What can CCA, or a couple of years, I should say, what can CCA Rhode Island do to plug some of those gaps that we saw exposed during COVID, whether, as you mentioned, transportation, access to brick and mortar, that can be, with Instead, delivery of paramedic services. Beyond that, what sort of vision do you have for the post-COVID pandemic healthcare ecosystem?
Well, I think we learned that, through the pandemic, that the disparities in healthcare are broad and wide, and there are people that are truly being left behind by the healthcare system. And when they weren't given the opportunity to go and readily access healthcare on their own, and they also weren't able to receive healthcare in their homes, a lot of people were really left behind. And, we believe through our approaches that we can really help improve people's psychosocial well-being, their re-engagement with the community, their connection with a good primary care provider, as well as our resources that are employees of Commonwealth Care Alliance that will help them navigate this very complicated healthcare system and encourage them to continue to engage in behaviors that will help their whole self. Again, meeting the social determinant needs is the first step. It's certainly not the last. And again, whether it's transportation or improvement of health literacy or addressing some of the other barriers, potentially, as Corey mentioned, moving the site of service away from the emergency department and back into the community and making sure that an individual has good follow-up care. We think that that's a big role that we will play. We also have a huge presence with telehealth and making sure that people have access, whether it's through their cell phone, their smartphone, their home telephone, to get health care in the location that they feel most comfortable, which may not always be the doctor's office. And continuing to advance through that continuum is how we believe we can essentially re-engage this community into health care and close a lot of the gaps that unfortunately COVID created.
We had Mayor-elect Brett Smiley here today, Lieutenant Governor Savina Matos. The pipeline between state government and key institutions in Rhode Island is probably a little bit tighter than in many states. The city and the state are essentially almost one operation. I mean, they're not. You ask anybody in city government and state government, they wouldn't tell you that, but it's very tight. What kind of relationships do you already have, and what kind of pathway forward do you want to forge with the city and the state of Rhode Island's government?
I met Brett when he was working for the governor, the prior governor, and we talked a lot about my vision for creating affordable and accessible health care for Rhode Island and to give the community another alternative. So that relationship obviously carries over while he's now in his new role as mayor. But we've also forged a relationship with both the current governor and the lieutenant governor. And we do believe that it is a partnership. And it's not just a state partnership, it has to be a local partnership. And that's why both offices play a key role. Healthcare here is local, and a variety of the initiatives that we want to advance will be potentially paid for by the state through its Medicaid resources or co-paid for as we use federal Medicare resources. But also many of these efforts are at the most local levels. So the mayor has a huge role to play. So we're really excited about the relationships we've built along the way and those that we will build tomorrow to continue to help the consumers that we want to approach.
Last question is partnerships with existing Rhode Island institutions. I kind of have a cheat sheet here because there's a whiteboard. I hope I'm not divulging intellectual property, but I don't think so in terms of partnerships with institutions like Thundermist, which has been a tremendous resource for so many people. You know, how do you fit into the existing health institution landscape here from that community clinic level all the way through, you know, some of the big power players that we have here in the state?
It's a great question. We talk about healthcare being local. In Rhode Island, it's hyper-local. And so that's done at the community level and even the neighborhood level. And so partnerships with institutions like Providence Community Health Center, like Thundermist, the communities that they currently serve, there's a lot of trust that goes into the communities, and the way that they've delivered care, particularly through the pandemic, really has established that trust base in those communities that's allowed them to do some things that are dramatically different. We've been partnering since CCA came to Rhode Island with local institutions like the federally qualified health centers, as well as bigger partners, hospital systems and health systems like Lifespan and Care New England and Prospect. Very important for us to make sure that all of our members, regardless of where they live, have access to the most appropriate care that allows them to have care that's delivered with dignity the right way. And many of the partners in Rhode Island have done that.
Gentlemen, thanks a lot, and congratulations on the ribbon cutting today.
Thank you very much.
Wonderful to be here. Thank you.
At HealthSource RI for Employers, we provide access to health insurance to more than 1,100 local businesses and nonprofits, and 96% of them renew through us every year. Maybe it's our choice of 19 different health plans, our 10 years of customizing solutions, or our one local team of dedicated experts helping employers find quality health insurance. See how our numbers stack up for you. Learn more at healthsourceri.com/employers.